what's your experience with cancer?
Well, I started practice almost 30 years ago. And the first few months of practice, I had 3 new patients come to see me, 3 women. One woman, I remember them all very clearly, but a lady in her mid-40s with obvious signs of aggressive cervical cancer. And another woman from Napanee who had presented with metastatic breast cancer. And then a third woman with signs and symptoms of advanced colorectal cancer. And that was in the time when cancer screening was starting to be thought about. And I've thought about those women down the road and now in my position, thinking how would things might have been different for each of those women had all the programs we have now today been present then. And the first woman with the cervical cancer, she would be one of those patients that you referred to earlier that just won't go for testing, didn't go to the doctor. She had a very difficult life and many other experiences that just led to that way of living. However, if she had ever been convinced of coming in for pap smears 5 to 10 years before that visit with me, things might have been quite different for her. The woman with the breast cancer, turned out that she had quite a family history of the disease, much more so than the average woman. And nowadays we would recommend a person in her risk to start breast cancer screening earlier. And for her, it might have been a different outcome as well. And then finally, the middle-aged woman with the colorectal cancer, despite being a very bright, smart woman, she ignored symptoms for some time. This was before we had colon cancer screening, but you know, we even now we have warning signs. We try to have people come in, but she chose to ignore them. She knew they were serious, but chose to ignore them. So with her, perhaps if there had been greater education about signs and symptoms of colorectal cancer, things might have been different. Certainly if we had a colorectal cancer screening program, I think she would have been the type of person that would have started that at age 50. She presented in her mid-50s. So those 3 women seem to have given me a lot of thought over the years. In subsequent years of practice, there are a number of other cases that really demonstrate where we are now and where we may go with other cancers. Peter is an older, mid-60s with lung cancer that I remember seeing at home. His wife asked me to come see him. I'd never met him before, and it was clear that he had very serious disease. I don't really recall about how many attempts he made at quitting smoking, but nowadays the message we give is very strong. Keep trying. At any age, stopping will have some benefit, not just in cancer, but in many other diseases, and perhaps his outcome might have been different nowadays too.
What do people need to be aware of before they're even identified as having cancer? What do they need to think about in terms of family history, etc., that would make them come in for a checkup?
Before they're worrying about coming in for a checkup, I would look at what are the activities that somebody might be doing or could do that would lessen the risk down the road. So this is the prevention. So if they coming to see their doctor and to say, my aunt has had breast cancer, what can I do to lower my risk? Well, the big ones for cancer is, of course, smoking. We've known that for decades. And as I mentioned earlier with Peter, it's never too late to quit. So there's new aids for smoking cessation, and there's lots of medical evidence that, even a person that smoked very heavily to age 50, if they quit by the time they're, I think it's 60, 62, their risk of lung cancer is back to the normal population. So I would talk to that patient and say, okay, what are your risk factors? Are you smoking? How is your exercise and your weight? Getting towards a good diet and good weight and good exercise lessens cancer risk significantly. So I would counsel them about that. Alcohol. The guidelines change from year to year, but clearly it seems for women over 2 drinks per day and men over 2 drinks or women over 1 likely increases your risk of certain cancers. So alcohol consumption and general alcohol consumption beyond that level is probably not good for you generally.
So I couldn't hold on to my alcohol and use it those days to use it on the weekend when I have more time.
Can't save it up. No, it's per day, and there's a lot of been myth out about red wine and cancer and health and things, but you have to, like anything, moderation. The other would be sun safety. We've seen a huge growth in melanomas, so careful sun safety. And then the other prevention things that you sometimes don't think of is, first, again, the cervical vaccine for young women, and hepatitis B vaccine given in young childhood prevents liver cancer. It's a very critical thing. So back to the patient coming in, we would talk about the prevention things, and then yes, a good family history is always very important. So out of 100 women with breast cancer, about 60 to 70 of them don't really have a family history of the disease. About 10 to 20 of them may have had 1 first-degree relative with the disease. And then there's a very small group, about 5% or less, that have had a terrible family history and have inherited breast cancer, a whole different topic. So that's a very small portion of the population, but it's important to identify those women. And they can be assessed at our Southeast Regional Cancer Program for inherited risk of breast cancer. And if through a number of questions and algorithms we find that their lifetime risk of breast cancer is really quite large, maybe 1 in 4 or greater, then they may be offered earlier screening or testing or genetic testing for a genetic mutation. So women coming in, the family history for breast cancer is important. Colorectal cancer, family history is very important. So if I have a 40-year-old man comes into my office and we're having the conversation about cancer prevention and screening, and he tells me that his mother or father or brother or sister had colorectal cancer, and let's say says his father, yes, he had colorectal cancer at age 52. What should I do? Well, that patient at age 40, at age 42 should start having colonoscopy for cancer screening of the colon. He's at high risk. If that 40-year-old man, after questioning, says, no, there's no family history, I had a great uncle with bowel cancer, or I had a grandfather, no first-degree relatives, then that person could be told, well, at 50, you could join the colon cancer check screening program and start with occult blood stool testing every 2 years. That would be the recommendation. So the recommendations you give a patient have some bearing based on their family history. For most patients, the standard recommendations are the ones. And I find that it's good to have the talk with patients, because I find a number of patients tend to overestimate the risk of cancer, particularly breast cancer, based on distant relatives. And it can increase the risk slightly, but women are often reassured to know that their lifetime risk has not changed that dramatically, and that standard screening is what they need to have, starting at age 50.
Let's go to the kit that you do receive in the mail. And we talk about people avoiding talking to their doctor about how they're feeling in terms of cancer. They don't come to their screening appointments. But that's another thing that we can set aside, that kit, and keep it on the table forever and ever, and then finally maybe get around to doing it. Is that the thing to do? Just wait until you're ready? Because what happens if you do it 7 months, 8 months after you receive the kit?
Well, there can be difficulties. The kits have expiration dates on them. Right now the kits last quite a long while. A new kit may be coming out in the next year or two that is not quite so long lasting, but much easier to complete. If you've been to your doctor and you've had a talk about colon cancer screening and you've got the kit from him or her, The best advice is to go home and try it, get it going. Men 60 to 70, we have a real problem. Often their spouses convince them to do it, but I think there's, for the colon cancer check, there's likely kits in people's cars, glove boxes, on the fridge, that they've been meaning to get onto it, but just haven't done it. And it takes a couple of days. It's something that most people don't like to talk about, but it's a simple test, and there's a lot of tools on Cancer Care Ontario's website and our website about how to do the testing. And it's very, very important to have that done every 2 years.